In this podcast, we'll talk about some issues with joints and some homeostatic imbalances with bones. The first topic that we're going to talk about are some inflammatory conditions that are associated with joints. There are three different major categories: bursitis, tendinitis, and arthritis. Since we've just finished talking about the bursa and the tendon sheaths, it will be easy for you to understand that when they are inflamed, that they're painful. The reason behind this is that the function of the bursa in the tendons, in the tendon sheath rather, is to produce a fluid that sits inside a pillow-like structure and to help the movement of ligaments and tendons over one another and muscles frictionless. Well, if the bursa or the tendon sheaths are inflamed, then they don't make that synovial-like fluid that keeps that structure to be like a pillow. And so there's friction when the ligaments and tendons and muscles are moving over one another. There's friction, and that causes a significant amount of pain. Now, arthritis is something that happens in the joints. This is also an inflammatory condition, and it's basically a degenerative type of disease. What happens over time is, if you remember that articulating cartilage that's on the end of the long bones, that ends up wearing. It's actually touching. There's maybe a limited amount of synovial fluid in the joint, and once that articular cartilage, the hyaline cartilage, is removed, then you have bone on bone. What this does is it stimulates inappropriate growth, so you'll have bone spicules, bone spurs growing out, and they can break off, and then it can start to feel like there is a stone in, like having a stone in your heel or your shoe. Well, that's what it feels like in the joint, and that sets up an inflammatory condition. Now, there are many different types of arthritis, but the most common type is osteoarthritis. And osteoarthritis is typically due to it's part of the normal aging process, but we accelerate it. Most of us here in the United States are carrying around too much weight, and too much weight puts a tremendous amount of strain on our joints, especially our knees and our hips, which is why we're having all kinds of joint replacements. And so osteoarthritis, having a hard time saying that, is basically a common chronic arthritis. We tend to treat it with pain relievers like Aleve or ibuprofen. The best way not to have to treat it is to prevent it, and maintaining an appropriate body mass index, appropriate BMI, is what we need to do. There's another type of arthritis that's quite crippling. It's an autoimmune disease. It's called rheumatoid arthritis. And this is when you build up antibodies to certain types of tissues in your joints, and that's what sets up the inflammatory process. Very often, individuals are diagnosed with this in their 40s, and it's usually treated. It's treated with a number of types of drugs, but very often it's treated with steroids. This is an X-ray, a colorized X-ray that shows what happens in rheumatoid arthritis. It's crippling because what it does is it basically seals the joints. In other words, you can see inappropriate bone growing here. And when that happens in a joint like right here, the joint sees up, and this individual probably cannot unbend this hand. It is permanently in a bent position. It makes it very difficult to be dexterous when you have this condition, and it's also painful. Another type of arthritis is gouty arthritis, or gout. This is due to the buildup of uric acid crystals, very often deposit for some strange reason in the big toe. And when those crystals are there, they're irritating, and that's what sets up the inflammatory process in this type of a diet. Very often, eating too much meat products with lots of animal DNA can actually lead to this condition, and it is more common in men. I'm not going to cover the developmental aspects I don't believe I gave you those slides. So we'll go to some conditions of the skeletal system in general. This is showing you, let me see if there's a picture. No, okay. This is showing you 3 different ways in which the spinal column, or the vertebra, I should say, can bend in inappropriate directions. In scoliosis, there is a lateral to medial twist in the spine. You can see that it's curved out that way towards the left. In kyphosis, there's a curve in the upper part of the back. You see this a lot in elderly. And then in lordosis, there's a curve down at the lower part. And you'll very often see that. You'll see that this woman's pregnant, and very often trying to balance the weight in the front causes there to be increased bending in that area, in the lumbar area of the backbone. Okay, the next type of skeletal homeostatic imbalance that we're going to talk about is osteoporosis. Now, I talked about this a little bit when we talked about blood calcium levels and maintaining them, and the fact that if we don't have enough calcium in our blood, that the osteoclasts will be stimulated to break down the organic matrix part of our bone, and it releases the calcium, and that can now diffuse into our blood and bring the calcium levels back up to normal. Osteoporosis is a bone thinning disease. 50% of women over the age of 65 present with this at various degrees, and 20% of men over the age 70. So it isn't strictly a disease for women, but you do see it primarily in menopausal women. And the problem is that over time, what happens is the bones become fragile and they can fracture easily. So a lot of times in elderly women, it isn't that they fell down off of a curve and broke their hip. Very often the head of the femur will break off, and that will cause them to fall. So the break happens first, then they fall. You can have the vertebral bones, the vertebra collapse, and this results in a kyphosis known as the Dowger's hump, which we looked at in the previous slide. And the reason we see it mostly in menopausal women is that what I mentioned in another vodcast, that while women are menstruating, their estrogen levels stimulate osteoblasts to lay down calcium in the bones. During menopause, that estrogen level goes down to a very low level, and therefore sometimes the osteoclasts, in their activity to destroy bone, can outweigh, their activity is greater than the osteoblastic activity. And this is a very good picture. Down at the bottom here, this is normal spongy bone, and very often it's the spongy bone area that is affected more in the bones. And so that's why the head of the femur breaks off, because the head of the femur is mostly spongy bone. And also the vertebra, as they collapse on one another, the body of the vertebra has a significant amount of spongy bone in it. And so the top diagram here, you see that it's very, very rough. And that means this osteoclastic activity, and the bone is being broken down. And that means that the calcium salts are leaving the bone, which makes it very, very fragile. And eventually you can see that if the trabecular structure just collapses, then the whole bone structure collapses. So because of the gradual osteoporotic activity, this is what happens to the spinal column in most women. At age 40, when they are still possibly 15 years away from menopause, the curvature in their backbone is normal. But by age 60, you start to see a little bit of the kyphosis, and then it gets much more significant by age 70. And you'll also see that this woman has some adipose tissue, or fat tissue in the abdomen. And this is a classic shape that we see as women age, that they typically postmenopausally put on additional weight in their abdomen, which is going to accentuate any of the pressures on the backbone. Okay, so I'm going to end the vodcast on homeostatic imbalances, and the next we'll go over what you need to study for the anatomical quiz, the anatomy quiz for this chapter.